Simplicity comes at an enormous price. And so, again, I want to remind us that as we have really clever ways to send people information about their diabetes, somebody else has a clever idea about sending them information about their bank account, somebody else about the books they've read, somebody else about the steps they took. It's now, all the people in China and India who never would have sent you a letter now send you an email. And all of a sudden, the data on how long American workers spend working without being distracted is, you don't have to laugh or to cry, but it's a question of seconds on average before something beeps or glings or beeps or does something. And so that's an enormous price that comes with simplicity. And I have no prediction what's going to happen, but it's going to have to change because, people just cannot manage the ease with which they receive information that they don't, that's really a bandwidth limitation. Unless somebody tells me which of the easy pieces of information to look at, I'm drowning in easy information.
This is our first generation of children who are less healthy than their parents in our country's history. And that is very concerning. We are seeing huge numbers of children with type 2 diabetes, with high blood pressure, with obesity, with inactivity, with addictions, with all kinds of diagnoses from ADHD to autism spectrum increases that didn't exist when I was a kid. Increased number of allergies. So those things concern me very much. On the other hand, I see this great development of technology and tools, not only for behavior change, but also incredible medical innovations. I felt like my whole early career, I kept saying maybe in the year 2000 we would have a vaccine that would prevent cancer. And we have a vaccine that prevents one type of cancer. That's a humongous, incredible technological innovation.
The last thing I'd love to leave, especially because I know there's a lot of life sciences people in the room, pharma and biotech, and I would challenge you to set your sights higher. So I've worked in your industry and I've worked with a lot of your companies in the last couple of years. This focus for things, use the words beyond the pill, you really mean how can we sell more pills? And there's nothing wrong with that at all. People need to take their therapy and they need to take it at the right place at the right time. But focusing on adherence, you're really selling yourself short because probably a consumer technology-oriented company, even one with a little more behavioral science involved, could accomplish that better than you can. What you're really good at and what you're leaving on the table is hardcore clinical evidence and massive distribution through the healthcare system. That's something that your companies have that everyone else is envious, whether you're Samsung or a startup or AT&T that wants to play in healthcare. They do not have the expertise to really dig in and say, here is the bar. We're showing you the clinical evidence at the gold standard that we have normally done for our products for decades.
Well, so in terms of the future, I'm really optimistic. I think that we are coming to a better understanding collectively about what motivates our behavior really from moment to moment, and individually about what drives our own behavior and how we can take better control of the decisions that we make, to put ourselves into better contexts, to put ourselves into situations where we can succeed. Just a quick example, where we work with the Childhood Obesity Foundation in Vancouver, Canada, and they have developed a program called LIGHT, Living Green, Healthy, and Thrifty. It talks to young people about how they can improve their health, not just by talking to them about health, not just by the sort of false simplicity of narrowing the conversation to one simple thing, but to talk to them about how their health is really everything. Their health is the health of the planet. Their health is the health of their bank account, the health of the financial health of their family. These things are all connected. And giving people a better sense of agency over their own lives and the opportunity to make better decisions for themselves. That's the opportunity that this technology is bringing us. And I, for one, am very excited to be part of it. What will it mean when your pancreas has an IP address? It's not just, it's not just our current state of technology that's going to change the way that we think about our health, but, there's a whole universe that's coming.